Thank you so much to the Peel District School Board and Board of Trustees for inviting me tonight to give you an overview of the COVID-19 school outbreak management guidelines that were recently released by the Ministry of Health and Ministry of Education. I do understand that this year is going to be a different school year and want to be able to walk parents, students, and educators through what they can expect should there be a case of COVID-19 in their school, and measures that everyone can take in the school community to keep it people safe. Next slide, please. So today I will be going over a basic overview of what COVID-19 is, and talk about what our experience of COVID-19 in Peel children, Ontario, and Canada has been to date. Next, I'll be speaking to a review published by Public Health Ontario about what the global experience of school reopening has been, talk about the guidelines for outbreak management itself, and walk you through a few case scenarios so you can get a better sense. And lastly, I'll talk about what the school community can do to reduce the risk of COVID-19. Next slide. COVID-19 is a respiratory disease that ranges from symptoms that can be from mild to severe. And so this is a poster that we've developed to help people understand the wide variety of symptoms that can occur with COVID-19. In particular, younger children, the most common symptoms that you may see are fever and cough. However, there are a wide variety of symptoms as well, as you can see. Once you are exposed to COVID-19, it can take up to 14 days after exposure to develop symptoms. A person is considered to be infectious 2 days before they develop symptoms to approximately 14 days after they develop symptoms. And exposure to COVID-19 is really through contact with respiratory droplets. And this would be considered 15 minutes of unprotected close contact within 2 meters. Or you would also be considered exposed if you had recently traveled outside of Canada in the last 14 days. I do mention what is considered to be unprotected close contact, as staff will be given medical masks and face shields as personal protective equipment. That would be considered protected. Next slide. Our experience with COVID-19 in children today in Peel has been that 5% of kids less than 18 years of age from March through to mid-July have been detected as cases. And most of these cases were acquired through household or close contact exposure. In terms of the split in the age groups, you can see that there's a fairly even split in the age groups, with a slightly higher proportion as you get into the older age groups, from 14 to 17. In terms of the incidence or the rate, 372 cases were reported and represent the 5% of in kids, representing an incidence rate of 111 cases per 100,000 population. This is low compared to the average incidence rate in Peel of 421 cases per 100,000. Next slide. This has been a similar experience across Ontario, with about 5% of cases amongst children less than 19 years of age. Infection rates were similarly also highest for those 15 to 19 years of age. Most cases, again, were acquired through close contact exposure. And in Canada, widely, it's a similar experience of those less than 19 years of age. It's also important to note not only the rate of infection amongst children, but also the differences in severe outcomes. So the proportion of severe outcomes, including hospitalizations, ICU admission, deaths, and complications, are much lower among cases in children compared to adults. For example, in Ontario, as at the time of this analysis in mid-July, 1 death had been reported in a child compared to 2,700 deaths reported amongst adults. Next slide. Public Health Ontario also did a rapid review of studies to look at what the evidence has been in terms of school reopening experience globally. And what they found was, to date, there was no evidence of widespread outbreaks of COVID-19 in school settings, and that children are less efficient as spreaders of COVID-19, particularly when there's low community transmission, which at the current time, we are considered to have low community transmission in Peel. School closures can have negative impacts on family expenses and lead to poor nutrition, education, school-based healthcare services, mental health, and emotional well-being. So we do understand that safely reopening schools is absolutely vital to children thriving and for their health in general. Next slide. So this is for your information around the current case counts of COVID-19 in Peel region. And this is a snapshot of 2 dashboards that we have on our website, and the link is at the bottom if you'd like to check it out. So on the left-hand side is our daily dashboard that gets updated, and you can change the city and the age group to determine the number of cases in there. And on the right-hand side is a map that we have displayed that shows the change of where cases are located and live within Peel. It's important to note when interpreting the data from the map that although the case counts in a particular area may reflect where a person lives, it might not always reflect where they acquired the infection. For example, early in the pandemic, we did see a lot of travel-acquired cases, and we are seeing an increasing proportion of travelers to date. However, still, household transmission is the majority of spread, the reason for spread within Peel. Next slide. Now we'll move on to the provincial school outbreak guidelines. And the Ontario guidelines define an outbreak of COVID-19 in a school as 2 or more lab-confirmed cases in students and/or staff with an epidemiological link within a 14-day period where at least 1 case could have acquired their infection in the school, including transportation or before or after school care. So I'll just break that definition down a bit. So when you have 2 or more lab-confirmed cases with an epidemiological link, that means that it is likely that one of those cases acquired it and is linked to an exposure from that first case. So we look for common areas where people may have been, such as the same class or the same bus. And the 14-day period is indicated because that is the length of the incubation period where you would expect cases to develop after an exposure, and linked specifically to the school. Next slide. In terms of roles and responsibility, there are several organizations with combined effort to ensure the safety of students and staff in schools. And so public health units, what our role is to assist school boards in consultation to help them with any prevention and preparedness measures. When an outbreak does occur, we have a role in investigating cases to determine the who, what, when, where, and why. So who may have been exposed, when, and quickly isolate close contacts through a method we call contact tracing. We then declare an outbreak when it's over, and we advise on control measures such as isolating close contacts, considered to be a cohort in this case, whether or not the school itself needs to be closed, facilitate testing, and on-site investigation. We also play a part in monitoring and reporting on cases, transmission risks, and monitoring absenteeism rates. And where the school lives is the lead public health unit for school follow-up, but we will collaborate with other public health units if, for example, a staff lives in another public health unit. That is the case. And of course, we assist with developing key messages and communication. Next slide. From outlined in the guidance for school administrators is to follow the Occupational Health and Safety Act, using guidance to implement infection prevention and control measures, reporting to public health when there is a lab confirmed case. And what is vital for our investigations are maintaining records of anyone entering the school so that we can rapidly contact trace. Coordinating with local partners and communicating with the school community on prevention measures and outbreak management. And of course, providing training to school staff as well. Next slide. So now I'm going to walk you through a case scenario to give you a better sense of what will happen if there is a symptomatic student or staff at school. So our scenario is a student develops symptoms such as a fever or cough, or a staff member or visitor while at the school. Next slide. In terms of actions, the teacher is to alert the principal if the student is ill or has one or more COVID symptoms, and continue to monitor the other students and themselves. The principal will then coordinate immediate student pickup and designate an area to isolate the student until the parent or guardian arrives. The individual attending to the student will use personal protective equipment, and the student will be advised to remain at home and provided an information package on the online self-assessment tool, how to access testing, and how to self-isolate. The principal will also ensure that all the portfolio information is up to date so that contact tracing, if needed to be initiated after confirmed case, can be done rapidly, and ensuring environmental cleaning and disinfection of the space and items used, and monitor the school population for possible new or additional illnesses. Next slide. From a school board perspective, the board COVID lead will continue to monitor attendance and absences and inform internally all the relevant administrators as needed. And the parent and student will follow the guidance of their healthcare provider or use the online self-assessment tool to determine if COVID-19 testing is recommended. And if tested, then we follow the guidance of the healthcare provider and related direction for isolation, return to school. It's important to note that if there's other siblings or members of the household that attend the school, they should remain at home as well until the test results of the student is known. Next slide. What can you expect as a member of the school community if there's a case of COVID-19 in your school? Generally, only probable and confirmed cases of COVID-19 will be communicated to the school community while maintaining privacy of the individual. Given that flu season and cold and flu season is upon us, and that there are several common symptoms shared with other known viral diseases or other medical conditions that COVID-19 has, we will not necessarily communicate to the school community about a symptomatic student or staff unless we have a high likelihood or suspicion that that person did indeed have a high-risk exposure and is likely to be a case of COVID-19. Next slide. So this is a bit of a busy slide, but I will walk through it. And what it does is outline two different types of exposure risks so that you know what to expect if you're a staff or student and when you can return to the school. So if you have had a high-risk exposure and public health unit has contacted you to indicate that you've had close contact with a confirmed case of COVID-19, you are considered to be at high risk and must self-isolate for 14 days after your last contact with a person with COVID-19. This is even if you test negative, as we do know that it can take up to 14 days to develop symptoms. And depending on when you tested, you may not have detected the virus. So the general guidance is if you've been identified as a close contact, you will be given advice by public health on when to test and need to retest if you develop symptoms later on. This applies also for people returning from travel outside of Canada. They must self-isolate for 14 days. If you have had a low risk or no known exposure, to COVID-19. So that is if you are appropriately and consistently wearing personal protective equipment, or you've not had a known exposure to someone, but you do have symptoms. You can return if your test is negative and you've been symptom-free for 24 hours. We do recognize that particularly mild symptoms that are known to persist in young children, such as runny nose, might be ongoing at the time of return to school if other symptoms have resolved and there is a negative test. You can also return if your healthcare provider makes an alternative diagnosis, such as allergies or an ear infection, and have been symptom-free for 24 hours. If there is no known alternative diagnosis and testing was specifically not recommended by your healthcare provider, you can return after symptom-free. And if you are not tested but recommended for a test, you must isolate at home for 14 days after the start of your symptoms. Next slide. If that symptomatic case then becomes a confirmed positive case, and that we have determined that the student attended school while infectious, public health actions include isolating the student's cohorts, and this will include the classroom, bus, and before and after school programs, isolating others with high-risk exposures, such as siblings or social contacts outside of school, and all contacts will be recommended to test and isolate for 14 days after their last exposure. Next slide. School-wide closures where the entire school might be closed would be considered if widespread transmission was seen. So this might be seeing cases that occur in more than one class, and there's not necessarily an epidemiological link. So you might see a grade 9 class and a grade 12 class, and it's not clear that there's any epi links between them because these cases are not linked socially, for example. It may be that because of the contact tracing, several classes may be considered under self-isolation, and we may need to isolate the school. And testing the whole school may be considered, especially if there's no epidemiological links. However, once the investigation is ongoing and complete with more testing results coming back, we may be able to gradually reopen a school if we can see that clear evidence that there have been no cases within particular cohorts and based on the likelihood of any epidemiological links between cases. So based on our risk assessment and case investigation, we will proceed to consult and advise the school and the school board on next steps. Next slide. Okay, so what can you do as a parent or a staff member or student to help keep your school community safe? So it's quite important to do daily self-screening at home for COVID-19 symptoms or exposure. And the province is coming out with a tool that will assist families to help to screen at home. Certainly get tested if you do have COVID-19 symptoms, and other household members should stay at home until your test results are back. And practice the core 4 behaviors. Practice physical distancing, lather up, washing your hands or using hand sanitizer for at least 20 seconds, mask up, and get tested. Next slide. Masks are important to help reduce the spread of COVID-19. Since COVID-19 is spread through infected droplets and has been shown to transmit from individuals who are not showing symptoms, wearing masks may help control spread. Masks may prevent your droplets from accidentally infecting others when they leave your mouth and nose, when you talk, cough, sing, or sneeze. Peel Public Health has recommended to school boards to consider requiring masks for students from grades 1 to 3 while in school, and strongly recommend the wearing of masks by kindergarten students while in school. This aligns with local masking indoor bylaws that have been passed by municipalities in Peel, and also aligns with recommendations in neighboring public health units and boards. Next slide. The following few slides will outline resources that you can refer to for more information about your particular school's reopening plans, and we have them listed by board. Next slide. We also have a number of resources that you can refer to. So if you'd like to look for the specific guidance that has informed the outbreaks, those links are here, as well as the online self-assessment tool to check if you need to be tested for COVID-19. Next slide. A number of resources for educators, parents, and students on how to wash your hands, self-isolate, put on and take off a mask, and what to do if you are tested. Next slide. We do understand that this is a challenging time for people as they are learning to live with COVID-19 and learn how to go to school during COVID-19. And we understand it may be stressful. And so there are a number of mental health supports that are available for parents to speak to their kids, or for kids to look up on their own as well. Next slide. That concludes my presentation, and I am happy to take questions at this time.